Your doctor probably never told you this. Right now, three specific vitamins could be the missing key to finally lowering your blood sugar and A1C. While millions of diabetics struggle with stubborn A1C levels, insulin resistance, and dangerous glucose spikes, research shows certain vitamin deficiencies can quietly make blood sugar control nearly impossible. In fact, correcting these deficiencies may help lower A1C by up to zero point 0.3 to 0.5%, improve insulin sensitivity by 20 to 35%, reduce inflammation, protect your heart, nerves, kidneys, and eyes. And the best part? You can start today. If you're diabetic or pre-diabetic, you already know the struggle. Your A1C won't budge. Your fasting sugar looks okay, but post-meal spikes are wild. You feel tired. Your feet burn at night. Your vision feels slightly off. Here's what most people don't realize. High blood sugar doesn't just damage organs, it also burns through critical vitamins faster than normal. And when those nutrients drop, insulin stops working properly. Inflammation rises, nerve damage accelerates, and heart risk increases. It becomes a vicious cycle. Let's start with number one, vitamin D, the insulin activator. Vitamin D isn't just for bones, it acts like a hormone and directly affects insulin production and insulin sensitivity. Your pancreas actually has vitamin D receptors. Without enough vitamin D, insulin simply doesn't work efficiently. Studies show that correcting vitamin D deficiency in diabetics may reduce A1C by around 0.3 to 0.5%, improve insulin sensitivity by up to 30%, lower fasting glucose, reduce post-meal spikes, and decrease inflammatory markers. Why are diabetics often deficient? Higher inflammation depletes it. Obesity traps vitamin D in fat tissue. Many people have limited sun exposure. Research suggests up to 60 to 80% of people with type 2 diabetes may have low levels. Deficiency symptoms can include fatigue, muscle weakness, depression, frequent infections, bone pain, and slow wound healing, and it often progresses silently. Beyond blood sugar, vitamin D supports heart muscle function, reduces nerve inflammation, helps protect kidneys, strengthens bones, boosts immune function, and may lower the risk of diabetic eye complications. Food sources include fatty fish like salmon and mackerel, egg yolks, fortified milk, UV-exposed mushrooms, and cod liver oil. But food alone is usually not enough. Vitamin D3, cholecalciferol, is the preferred supplement form. It comes in capsules, soft gels, and drops, often combined with K2. A common therapeutic range is 1,000 to 4,000 IU daily, taken with a fat-containing meal. The general upper safe limit is 4,000 IU daily unless supervised. High doses should be monitored, especially in people with kidney issues. Now let's move to number two, vitamin B12, the nerve protector. Vitamin B12 is essential for nerve repair, red blood cell production, and brain function. Here's something many people don't know. The widely used diabetes medication Metformin can significantly lower B12 levels over time. Up to 30% of long-term users may develop deficiency. Other risk factors include aging, poor gut absorption, and chronic inflammation. Deficiency symptoms can include burning feet, numbness, tingling, memory issues, fatigue, and mood changes. Many people assume these are just diabetes, but sometimes it's B12 deficiency. While B12 doesn't dramatically lower blood sugar directly, correcting a deficiency improves nerve insulin signaling, reduces inflammation, and supports metabolic pathways, which indirectly supports better glucose control. B12 also lowers homocysteine, a heart risk factor, slows nerve damage progression, supports kidney cell repair, supports bone marrow function, strengthens immune response, and supports optic nerve health. Top food sources include beef liver, sardines, eggs, dairy, and chicken. Plant-based eaters are at higher risk. Supplement forms include methylcobalamin, preferred, cyanocobalamin, sublingual tablets, and injections for severe deficiency. A common dose is 500 to 1,000 micrograms daily. It's best taken in the morning. It's very safe, and excess is usually excreted in urine. Now, number 3. Vitamin B1, also known as thiamine, the sugar metabolism engine. Thiamine is essential for converting glucose into usable energy. Without it, sugar builds up in the bloodstream instead of entering cells efficiently. High blood sugar increases urinary loss of thiamine. Diabetics may lose significantly more thiamine compared to healthy individuals. Deficiency symptoms can include fatigue, brain fog, nerve pain, swelling, and even heart palpitations. Studies on higher dose thiamine and its fat-soluble form, benfotiamine, show improvements in fasting glucose, post-meal glucose control, and markers of vascular damage. Thiamine helps protect the blood vessel lining, supports nerve conduction, reduces kidney damage risk, improves cellular energy production, reduces oxidative stress, and may help slow early retinal damage. Food sources include sunflower seeds, lentils, whole grains, peas, and pork, but refined carbohydrates strip thiamine from foods. Supplement forms include thiamine HCl and benfotiamine, which has better absorption. Clinical study ranges are often between 50 to 300 milligrams daily, with benfotiamine commonly used at 150 to 300 milligrams. It's usually taken with meals and is considered very safe at typical supplemental doses. Let's quickly recap. Vitamin D improves insulin sensitivity. Vitamin B12 protects nerves, especially if you take metformin. Vitamin B1 supports proper glucose metabolism. Correcting these deficiencies may help lower A1C, improve insulin resistance, reduce complications, and protect your heart, nerves, kidneys, and eyes. You are not powerless. Sometimes it's not just about adding more medication, it's about correcting what your body is missing. If this helped you, like this video so more people struggling with diabetes can see it. Subscribe for science-backed health content every week. And comment below, which of these 3 vitamins do you think you might be low in? Your health is in your hands, and now you have the knowledge to start.